Hello, my name's Rosemary and I'm here with Cancer Stories. I've had cancer of the mouth and neck and I hope you'll go and have a look at my video.
Buster's suddenly appeared. Do you think he'll come into the shot? Can you persuade him to get up on your lap?
Indoors is very difficult. Let me take you off your lead. Right, now Buster, come up here. Come on. I might have to go and pick him up. Come on. Indoors he will. Very easy microphone. Whoa. There we are, Buster.
He doesn't want to stay there, that's fair enough. But at least he's made an appearance in the video, that's the important thing.
He will, sit like this.
He's on there for posterity.
There you are. That's his best look.
Does Buster realise he's having a starring role here?
You are. I'm Rosemary and I was born in Rugby many decades ago and lived reasonably through all ups and downs of life until the dentist referred me in 2005, and in 2008 I was diagnosed with cancer of the mouth and neck, which proved to be quite aggressive. So I wish it had been diagnosed before it was.
Rosemary, thanks for coming in today to join us on the Cancer Stories programme. Can I ask you a question straight away at the beginning about how your cancer was found out and whether you were satisfied about that process?
Well, it was a strange sort of process really, because in 2005 my dentist found a mark in my mouth and he said, I would like to refer you for that, and that goes through to the consultant, the expert in these matters. And I had 3 years of appointments with the consultant. And he would keep telling me I was chewing my mouth at night. And so I bought, on his recommendation, I bought these very expensive gum shields, and still I was allegedly biting my mouth. But I was very fortunate because after the 3 years I had an appointment and I was waiting, and I thought, I'm going to discharge myself during this appointment. But it was a registrar, and he was apologising for only being a registrar. Now, I think registrars are brilliant, and he actually said, I'm going to take a biopsy. And really, that just set things going, because they found it was cancer of my mouth. And I think also that summer I was on holiday somewhere. I had tonsillitis, and I must have gone on the holiday after the tonsillitis, and I was left with a lump here. And I saw a doctor while I was on holiday as well about it, because it was causing problems, and it materialised that that was the neck cancer, which was the secondary. So it had travelled from the mouth to the neck, and it had got into the lymph nodes, and it was overflowing out of the lymph nodes. So it was quite a bad state to be in. I know that now. I didn't know it at the time because it's not an area I really know anything or knew anything much about.
So your cancer was diagnosed in quite an advanced stage?
Yes,
at
it
the
was.
time.
Yes, it was quite serious. It was quite aggressive, or very aggressive, I was told.
What was your reaction emotionally with that coming out of the blue, albeit that you'd had those symptoms which were perhaps told to you to be something else for that time?
I was told it was cancer, there'd never been any mention of cancer, so it was a shock. And I can remember sitting there thinking, cancer? No, I haven't got that. I'm healthy, because I was healthy. And so it was just a total shock. But see, after that, well, at that point, you see all these different people and they're explaining what's happening, but it sort of just goes into mist, really. A lot of it you don't hear because you're still thinking, oh, this isn't me doing all this. I'm the healthy one. I'm the one that eats all the fruit, Everybody else is eating their McDonald's and I'm eating my fruit and getting exercise. But anyway, at that point, the carpet goes from under your feet because then you have to have a lot of the tests, excuse me, blood tests and x-rays and so on and so forth, and tests on your heart and all the rest of it. And then you suddenly have a date for an operation 2 weeks after it's diagnosed, and that's it. And there, I expected 2 weeks in hospital, as I was told, and I did expect that after the 2 weeks I would be up and running again, same as I was before, perfectly fit and healthy. I'd even considered, I won't bother to tell anyone I'm going into hospital. I'll just keep sending them text messages. I think I'm fine, and nobody need know about this. Just have it all cut away and then back to normal life. And how wrong I was. A new life was before me.
I heard there then that surgery was scheduled and you underwent quite an extensive operation. Was it just a one-off operation or a series of operations?
It's many bits of operations in one, really, because I have the vein taken from my arm and the lump of muscle and so on. And they cut out all the bad from the mouth and put in this and wire it all up, which is very, very clever. Clever piece of work. I'd rather it hadn't been on me, but there you go. So there's that bit, and then they take a bit of skin from here to fill that bit. That's right. So it's that operation, this one. But after that, the result of the operation was that they couldn't cut enough margin. This could put you off fried eggs forever, but I see it as a fried egg, with the yolk being the cancer and the white is where they're able to cut round to make it safe. But with mine, they couldn't get that margin. There was no white. The cancer went to within 0.5 millimetre. So I said, well, not a very good result, really. And the neck piece didn't go very well either, because that was worse than had been anticipated. So the whole thing was a lot worse than was originally thought. And somehow during the course of the operation, they twist you in all sorts of different directions. And I was standing on my shoulder at one point because after the operation, my arm had come round here, and I can show you with the other one, my arm came right round there, and I had to have a lot of physio on this to get it back almost to where it started off, where it should be. So that was a little additional a bonus, if you like. But there was the radiotherapy, and I finally agreed to the radiotherapy. I wasn't keen on it, but when I finally agreed, well, we need to do a little bit of chemotherapy as well, just because the radiotherapy then works better. During the course of the chemotherapy, one of my kidneys seemed to stop its functioning. So I only had 5 lots of chemotherapy instead of the 6. So I think they wanted me to keep the other kidney, you know. And then I said, how much damage is caused to my kidney? And they said, well, a lot of people live with 1 kidney. And I shut up. I wish I'd pursued it a little bit more at the time. I would like to know if it's functioning a little bit, or it doesn't really matter anyway now. And the radiotherapy has caused quite a lot of problems, really, because it stopped the tongue working properly. It's made my face like a piece of wood. It's just solid. And yeah, it's affected my throat a bit.
It also caused some necrosis of the jaw, didn't it?
Yes.
Which broke down, and you ended up having to have further procedures, and also wear protective cords there for a while.
Yes, the necrosis of the jaw, then the body was rejecting the dead bone, so it was trying to get out through a hole in my face. It was making a hole there to come out of, and I did have a week back at the hospital because they were trying to stop it coming out. It was better when the body was left to sort itself out. So, you know, odd days I think, oh, it feels a bit rough there, and I'd get the tweezers and pull out a little bit of bone. Oh, what do I do with that then? I throw it away. So, it's my bone all over the place. Mind you, it was dead bone, it was no use. And then a few days later, oh, another bit of, pull the bone out, throw it away. Well, there's a lot of this happening. But anyway, then eventually it stopped, so I didn't have to have my face bandaged up all the time. But it's made a few holes here, so that's another little thing. And then the blood vessels burst, and that's... I was offered oxygen therapy, which is used on divers that get the bends. And I went down to see the setup and the thing you went in, and the 2 gentlemen there were really good at explaining every little detail about the oxygen therapy and how it worked and so on and so forth. And that can enliven the bone so that it can bring it back to life. If not completely, it can do it partially. But sadly, the PCT refused it, which is a shame because it was going to work out quite a cheap therapy if they made full advantage of the fact that you could have 12 people having therapy at the same time. I personally knew of 4 others, or 3 others, that would have gone, and I'm sure there were more in big, you know, could have scraped the county, got 10 people, 12 people. So it would have been quite a cheap thing. I think it was £120 a treatment or something, so it would have worked out to 10 per person, wouldn't it? We'd have even paid it ourselves, really, I suppose. Anyway, PCT refused it, so that was that. That, I think, was a shame, because I'd like to have kept the jaw, because that then has affected teeth, and so I have quite a lot of difficulty with teeth. And at one time I was developing fangs on my front teeth. And so the dentist, I can't go around like this, like some monster. And he's been ever so good, he's been patient all the way through, and he built me some teeth, you know, just filled in a little bit that was missing, hence got rid of the fangs.
So you've had a struggle, really, getting back to normal after initially the surgery, then the chemotherapy and radiotherapy. And that radiotherapy's caused those long-term delayed side effects, which only recently have started to resolve, I guess.
What it is down to now is me accepting it and building my life to encompass those things, so that they're not a piece that I'm getting angry with, but they're a bit of me that are part of me, and I've got to build around it. When I go to restaurants, people are really good there, and they'll give me the extra serviettes, and I'll have a spoon instead of the knife and fork, because there's no point in those. And so I'm having to encompass it and include it in my plans. So there's a lot more planning before I do things or before I go to places. There's also a lot of medication, because I have a tremendous amount of pain in my mouth, a lot of soreness, ulcers, and so the painkillers do a lot. But then I have a spray as well, which that helps a tremendous amount. But there is always pain there, sadly, of one sort or another.
What came next after the procedures were behind you? Did you have to make any changes in your lifestyle?
There were many changes. There really wasn't anything that remained the same. There was, well, my job had gone because I wasn't able to do the job anymore, because I couldn't speak clearly enough, and there's a certain amount of saliva problem. And
what were you working as?
I worked as pastoral support in a secondary school, and it was a job I tremendously enjoyed. And
it must have been difficult to give that up.
Well, when I think back to it, I feel it makes me smile, because there's so many funny things there, but it makes me sad that I'm not able to do the job. Although I believe the job has changed a lot and I wouldn't enjoy it so much, but when I was there, it was great. But I was retired rather than hand in my notice and leave.
You retired on grounds of ill health?
Yeah.
So you had to give up your job. There was a change in your lifestyle then. What did you replace that with?
I started to try and do a bit of cycling, but I couldn't even get to the end of my road. I would fall off. I seemed to have a balance problem, which I didn't know until I got on the bike, or didn't, as the case may be. So, yes, once or twice I fell off in the road, and people walked up to me as I was laying there with a bike on top of me and said, "Are you all right?" Like we do. And of course I wasn't, because I was laying in the gutter with a bike on top of me, which wasn't usual behaviour. But
so you tried out the cycling, but it didn't.
I tried that.
It didn't really work for you.
No, I didn't want to give it up completely, but that's been a difficult one to try and rebuild. But I used to go out for walks quite a lot, and then I got more interested in wildlife and nature, I suppose, and the trees, and I was seeing a lot of different colours. So I thought, well, this is the way I've got to go. I've got to go on to different things. I've got to be interested in, develop different hobbies. Now then I bought a proper camera. I say a proper one because I'd been using sort of shoot and click thing. I'd had a digital camera, but this time I bought a more proper thing, you know. And that's would be all-encompassing if I allowed it, but I wanted to have a few other things in life as well. And I needed to see friends still, although I did find that friendships altered a bit gradually, and new friendships have come out of this sort of cancer pathway, whereas others have probably drifted off a little bit.
Who have you met along the way?
There have been some amazingly interesting people. I've met so many really terrific people. I've even met doctors that are terrific people. So, you know, it's all been quite a surprise. Other people that have had cancer. So, yes, I would say interesting, and there's been a lot of support of late, which has made a lot of difference. There have been the groups running on a Thursday, and I found that tremendous support, because there people have similar problems, but it becomes a lighter thing when we start talking about it. It doesn't seem the most important thing always. And then there's the Head and Neck group at Coping with Cancer, which that equally has been a terrific support, and that's doing things from a different angle to the Thursday groups.
I heard you mention about the support groups. What do you think about resources to help cancer patients in general?
It's possible that we're very fortunate in Leicestershire, because we have the Thursday group organised by the psycho-oncology department, and the Head and Neck organised by the Leicester Royal, which is run at Coping with Cancer. But in addition to those, there are quite a lot of other support groups on the go, because I was going round Wistow Maze a few years ago, and a man saw my arm and he said, "Snap," and he'd got the same thing. And that was another contact, and he gave me his details, which I've kept, and he said, "You know, we're there for you." And that was one group. And then I've heard of two more running locally in Loughborough. And I would like to think there is this choice of provision in the rest of the country. The only difficulty is finding these things, really. And we're not all going to be lucky enough to bump into someone in the maze that's got the same thing. Most of it is serendipitous, I suppose.
Is there anything else that you've come across that's a valuable resource that you'd recommend to others? Or in general, any recommendations?
I would say Macmillan do a terrific job. And it was just by accident. I was given the phone number of someone who did a terrific thing for me, and that was Macmillan. But through Macmillan itself, I wouldn't have got that number. I got that through someone at the Thursday psycho-oncology group.
Sometimes, like, these contacts can lead to another contact, and
yes, that's right.
Sharing ideas and resources can lead to other things.
Yes, some of it is just opening your mouth or listening, and then you find out about these things, or making sure that someone's got the contact number. And there's something I'm doing with a guy at Loughborough University. He's doing his PhD, and he wants to interview people about their diagnosis.
Mm-hmm.
So I'm going to do a little bit for him, and that will be spreading the word amongst others there. It's just bumping into people, or me bumping into others.
In general, if you were faced with a new patient who was starting from scratch, could you give them any advice or tips based on your experience?
I'd suggest a great many things, yes I could. I would certainly suggest going to visit Coping with Cancer. The choice of activities and help there is amazing, really. And to even go and just sit there, if you're feeling unhappy one day, you can go and sit there and be so comfortable. It's a good atmosphere, and they'll make a cup of coffee for you, and you just feel lifted, which is amazing that just being there can do that. But there's plenty going on there, and that can lead on to all sorts of other things. Well, I have had a lot of alternative therapies. I've had many sessions of Reiki to help my jaw, because I was in a tremendous amount of pain with that, and nothing would alleviate it. So the Reiki was amazing.
Can you describe Reiki for the viewers?
Well, the Reiki seems to send you into a different sphere somehow, and it's the Reiki master or whoever is doing the treatment will gather energy and put that into the damaged part, or all over the body if needs be. And there's a difficult thing for people to grasp, really, this idea of getting the energy from the universe. And anyone that goes into it has to go into it with a clear mind, an open mind, and ready to accept, because accepting the treatment is a great part of it, not expecting it to be given to you. You have to accept it and invite it in.
So what other complementary alternative treatments would you recommend apart from Reiki?
Oh, well, I've had Indian head massage, that's quite a good one. And I've been to various relaxation sessions, and one meditation that I go to at Shepshed, he's an expert, and I go there on Mondays or Thursdays, depending when it's running. And it really takes you away from your body almost. It's so powerful, and it gets things in perspective.
All told, what do you think the role of complementary treatments is alongside your medical treatment?
I think, yes, I would say you definitely need to have both. If you're able to accept the complementary therapies, they are really worth having running along with the others, and then they can keep running when anything else is finished, apart from painkillers maybe. But they can run along with the painkillers and be more use even.
Is there an issue accessing them because they're not always freely available?
Some things can be accessed without paying if you're extremely fortunate, and that will be for a short space of time anyway. Mostly you will have to pay. Occasionally I've been used as a demonstration model for these therapies, and then I get that one free. But I pay for Reiki when I have it anyway now, which is not the cheapest thing. If you have acupuncture, there's quite a few surgeries now performing that. I sometimes wonder if I could have acupuncture to stop the pain on my tongue, but who knows. And the meditation group I go to is £2 a session, so it doesn't quite break the bank. And occasionally there's free sessions there, because he's not profit making in any way.
So overall, it sounds like you definitely advocate complementary and alternative treatments.
Yes, I do, because I think they carry on from the medical treatments that are given, kind of have a limit. But the meditation and Reiki can go on forever.
Are there any other recommendations you'd make? Anything else you've come across that you'd say to patients, this is definitely worth looking out for?
I certainly think if any friend says to you, oh, I've got an ulcer in my mouth, or I've got something in my mouth that it's not, was that like yours, or it's not going away, I would certainly say get it checked. It was the dentist that found mine, and they are very good at looking at these things and recognising what's okay and what's not. And they can refer direct, or the GP can refer directly to the consultant or the department. And it is, for friends I've mentioned, sort of go and get it sorted, or looked at, I should say, because it's probably nothing. But 3 of those came back and they were clear, one wasn't, but it's dealt with without causing a lot of post-operative difficulties.
So one of your recommendations is for the public to watch out for these kind of symptoms.
Yes,
and go and seek
yes.
help.
Oh, certainly, yes. It's better to go and find it's nothing than to leave it and leave it and leave it and then find it's a big operation.
Okay, that's good advice. I notice you've brought a little dog with you today. Is that something new since you've been unwell? What's the story there?
Oh yes, he only came along to me about 2-3 years ago, and he belonged to a friend of mine, so I'd known him all his life, but he did need to be rehomed because of bigger dogs moving in as guard dogs, and he kept going up to them and telling them he was the boss by hanging off their jaws. So my friend said he needs a home and you're the top of the list. Other people wanted him because they all thought he was terrific, but I'd asked first, so I got him Well, since that, I have to get up every morning, go for a walk, and I have to try and keep my mood up because he's very sensitive to moods. And I have to get out and about and bump into people, and I've met a lot of new people that way.
So can it actually be therapeutic, having that dog around?
Yes, it is. Well, first of all, you're going out and you will see people, whatever the day's like. And that's a helpful thing. In fact, I've just realised it then justifies you can have the rest of the day at home because you don't need to see anybody else. You have to have that little bit of human contact because I live in a house on my own and I only have an elderly mother and a brother who's living 120 miles away, so there's no great family contact. But now there's Buster.
Yeah.
And he is, yes, I suppose he's sort of a sub-chapter because he's altered things since he came along. And so I've built another new life. Well, yeah, because he does tend to take over. Because if I'm going anywhere, I've got to think, no, will Buster be all right there? And yeah. So it's odd because when I was going for speech therapy, the therapist kept saying, what about getting a little animal, get a dog or a rabbit, you know, any of these things. And other people, they were joining in, saying, yeah, should we get one? But I didn't. I said, no, because I thought, well, I'm going to be dead before. And, you know, if we get a dog, he's going to outlive me. And I didn't want that to happen. But anyway, I got one because he needed a home, so it obviously meant. And yeah, so they were right.
It sounds like he's brought a lot to your life.
He has. It's a whole new dimension, really. Sometimes I have very bad days and I have to stay in bed. And I will be asleep for most of the time, so I will be sleeping for like 36 hours more or less. And he's so good during that, and he'll stay with me every moment. And probably once or maybe twice in all that time, I will get up and let him out, and he'll come back where we were, and he'll stay with me. And after I've had this enormous sleep, I will then be okay to move again. You know, I don't know what that is. It's probably the accumulation of the painkillers or something. I don't know. But he's brilliant.
I'm going to ask you now about how things are at the moment for you and how you plan for the future. Is it taking each day as it comes? Do you look further ahead? Are you still making plans to do things? Where are you at the moment?
I don't make any plans. There are certain things that have to go in the diary, and most of them are, I'll make plans about 2 weeks ahead, but nothing's too rigid usually. And some of my plans get broken because my mother needs me to try and look after her as well, which, that's difficult. My plans don't go very far because I live for the day I'm in. And I would say that to anybody, live for the moment that is, because you could be dead in the next moment. So you have to make this moment count. The only thing I've got one thing I want to do in the next few years, and that's to go back up to Norway, because I find it beautiful up there. So I hope to do that again. But other than that, I don't make any future plans. And if I thought about the illness and the future, it doesn't feel that good, so I just keep my eye on the day. Yeah.
Is that a tip for others if they're facing an advanced or progressive disease as well? How could they manage? They may be wondering the same thing, but...
I have to make every day count. And I have the day in its 3 sort of sections, like the morning, afternoon and the evening. And for 2 of those sections I like to have something definite. Well, the dog has taken over the first section anyway. And then there's the next bit where I try and have something definite to do. And then there's the evening section, which allegedly was for rest, but that one hasn't come for rest yet, because I want to sit and read. I've got an accumulation of books I want to get through, and these have accumulated throughout my life, before and after. And this is the opportunity. I just got to make that bit of time in the evening.
But I like your idea of breaking down the day into those areas, those sections, and then filling it, knowing what you're doing, planning in advance.
What I don't want to do is get to the end of a day and think, well, what have I done today? And think, nothing memorable.
Yeah. You try and avoid that, yeah.
Yeah.
Well, it's been a pleasure talking to you today, and I know you've been through a difficult time, and it's only recently that some of those complications that you've been facing have settled down. And it's nice to hear that there's some positives in your life, and nice to hear that you've got a way of coping day to day, even when the challenges are there. So thanks for sharing with us your story.
It's a pleasure.
And I wish you all the best for the future.
Thank you very much.